Why should BIPOC communities trust these vaccines?
Our team has worked incredibly hard to ensure equitable inclusion of BIPOC people in the vaccine trials. At a very minimum, we were ensuring that all of the NIH-funded trials had BIPOC people in them that represented the composition of the United States, because it was our belief that we needed to create a vaccine that was going to work for everyone, particularly those populations that are most disproportionately impacted. And if you look at who has the highest cases of COVID, who has higher rates of hospitalization, who has higher rates of deaths, it's people who look like me. It's Black people, it's Latinx, it's Native and Indigenous peoples. And among those peoples, our elders are at incredible risk of not only hospitalization, where they're in ICUs and on ventilators, but also death. The death rates in the Native and Indigenous communities are horrendous. And for a culture that has a history of genocide in this country, it makes me personally incredibly distraught when I see my friends losing a cousin one week, an aunt the next week, a grandparent the next week. So we need something, we need interventions, and we have two amazing vaccines that can really turn the tide in communities that are hardest hit by COVID.